Hi, a very pleasant and hearty welcome to the YouTube channel of Dr. Pramodu's Institute of Sexual and Marital Health Private Limited. Today I got a very precious couple with me. They have been married for 7 years and they are living abroad. They are going to share their experience for all of you. Yeah, please.
Hello. We were from London, and we've been married for 7 years, and we were happily married. Like after a month, I had to go back to UK, and she had to stay here in Kerala. And after a year later, we were back together, and we had, nice, lovely couple, as everybody's seen. But in the bedroom, it wasn't all that happy because for her it was more painful and more anxious and pushing away when there's attraction, stuff like that. And we were like wondering, what's going on, and so we went to different institutes. And
Was it a fear or pain? What did you experience actually?
I think it was both.
It was both.
Yes, it was fear as well as pain too.
Mm-hmm.
I think it was
During the initial attempts of sexual contact, actually what happened?
It was actually a fear.
Fear.
Yes,
Fear of what? Fear of what?
A fear of pain.
Pain.
I think I was thinking in my mind that it is too painful to have an intercourse, and so I was like trying to push him away and not cooperating with him.
What made you to feel that fear? Was there any history, means any traumatic experience in your life during the childhood years or teenagers?
No, there was no traumatic experience or anything, but I don't know, I had mentally a misconception or kind of something.
Now, have you come across any stories or any of your friends got married and explained their traumatic experience with you?
Yes, once, yes, before I got married, one of my friend got married and she said that yes, it is a painful.
Yeah, what was her description of the whole event?
She told me that the first time they tried sex, they tried to use oil, they tried to use the gels and everything, but then they were not able to, have an intercourse. But then she was saying that he tried to put it forcefully into her, and it was really painful for her. So she told me that once, yes.
Yeah.
So maybe that's why I had a thinking in my mind that, it's a painful thing.
What was your nature from childhood onwards? You said you have been very anxious.
Yeah, I was anxious only in bedroom when we.
Otherwise, you are not an anxious
Otherwise,
person.
I'm not an anxious person at all.
Fine. Yeah, tell me the experience in bedroom.
Yes, so in the first couple days, we just had foreplay and everything. It was really good. But then when we came into sex, the first time it was like, it was not in my mind that it's painful or anything. But then when he tried to insert it, it was kind of painful for me. Mm-hmm. And the thing she told me, my friend told me, that was going in my mind too. So, it was kind of a fear in my mind.
Then what was your reaction when he tried for a penetrative sex? How did you respond? How did you react to in that particular moment?
My reaction was like, I was sweating, I was anxious. I was telling him that we'll try later, just give me a gap. He was really cooperative with me.
Yeah.
And I was like trying to push him, but I really wanted to do it.
Trying to push him with your hands or with the thighs?
With my hands.
With your hands.
Yeah.
What about the thighs or legs?
It was closed.
It was closed.
Yeah.
You used to keep it very closed.
Right.
So that you won't allow him inside.
No, I tried to allow him. In my mind, it's like,
You
yes,
wanted
we
to
want.
allow.
Yes.
But unfortunately, you could not. You were unable to.
Right.
Okay.
So I allow him to come in, but then I get my muscles contracted, and my thighs get closed, and I have that fear that it will pain, so I don't allow him later on.
Yeah. What did you observe during those periods?
Those periods was really, it was kind of sad to see her cry, and I didn't want to force it, but I want to enjoy while we're doing it. So it's most likely, I kind of knew that she was scared of it, so I had to take it easy. So we took like a long break after that, so I want her to be calmed down, and we can try it later. So we just kept moving, and years went by, and it wasn't still happening. Then the family started asking questions, and the friends started
After
asking
how many
questions.
years of marriage? Family
At least
started
like
asking?
2.5 to 3 years. They start asking, nothing's happening. What's going on? Is there a problem?
Yeah, there is no kids.
There's no
That is
kids.
what
Exactly.
they are worried.
Yes, exactly. So then we started looking around for gynecologists and to see what they reaction or what they said. Then she did like
Now, where did you meet the first gynecologist? In London or
in
Kerala?
London. In London.
Yeah, what was the experience?
The experience was good, but the end result wasn't what we expected. We had to. She had to do a bunch of blood works, all these tests, and
Yeah.
everything came out normal. They just said, just go home and just do it.
That
there's
means
nothing
all
wrong.
the laboratory investigations were normal.
For it was
fine.
all the results wasn't everything was looking good for them, but not for us. So her mom.
No, did they say, tell you, guide you
Yeah.
in whichever way you can sort out the actual problem?
They-
Actual problem was not able to consummate the marriage.
Right, they never find out the real issue. They just said do exercise, and you could just it will be okay.
So they gave me a couple of YouTube channels which says that there's a exercise to loosen up the muscles. They told me several exercises. I tried that several times, but then when we come into the bedroom, still it's like
It's not working.
it's not working at all.
When you want to relax, when you are alone, you are able to do it.
Yes, I
But
am.
in the bedroom,
I'm not able to.
not able to.
It's still
Okay,
like contracted. I'm like getting anxious, and the same thing goes on again and again. So
So when the repeated failures occurs, what was your mind, in your mind? How was the reaction? How did you experience it?
it was actually very much stressful for us. It was very stressful, and we had to answer the parents. I don't know what to tell them. They were asking like, why you not like like having a baby, and everyone of our age is like having 2 kids and 1 kid and all those kind of things. So we were like not able to explain them that this is the problem. So like it was really stressful for us.
Then how many doctors you met?
So in London, it takes like couple of months to get an appointment. So we have like every year gynecologist appointment over there. So every year I go to the doctor, and then I explain the whole thing from the beginning. They are like, they surprisingly look at me because they have never heard a thing like
Yeah,
this.
they don't know.
They don't
They are
know
not
about
aware of
this.
this condition.
Right. So they've never seen a case like this. So they were like, the same thing, like gave me exercises, they gave me some gels and, to make it more easier, but that was not possible for us.
Then did you consult anybody in India?
No, we didn't consult anyone in India. So my mom, she used to watch your videos. So she forwarded me some videos of yours, and it said that it's easy, they'll counsel you and give you all that sex therapy and kind of stuff. And it's easy over here to get treated. So we tried here.
Yeah.
One of the greatest thing was we didn't need an appointment here, and it was
Yes.
just walk right in, and they are very friendly. All the staffs, and everybody was
So,
very friendly. And they,
what do you feel? What is the difference between your visit to other hospitals and here? What makes the difference when
So-
you explain or when you discuss your problem?
we when they're like, oh, that shouldn't be a problem, at other hospitals and stuff. Oh, we just have to do it. They really didn't know what the problem was, or they didn't even try to find it. And here, when we came to Dr. Promodu's Institute, we had right away we felt very homely, friendly, and they took us in right away, like as a family, and we talked, and we had like a plan to have the consultation and the exercises and the procedures, how things were.
How was your experience with the gynecologist here? When you met her for the first time, usually when you go to the gynecologist, most people are very scared. They may do a pelvic examination and that is going to be painful. So how was your feelings and the response of the gynecologist?
So the first time when I met a gynecologist, I took an appointment. She started to do a PV for me per vaginal, but then
There in London.
in London itself. So at that time, I told her that we never had sex. So she was like surprisingly looking at me. She was not able to accept it. Like after 6 years of marriage, you didn't have a sex. So that's when I first time told the gynecologist about that. But they didn't accept it. The difference I saw here was when I explained to you, the people over here was too much accepting the thing that yes, there is a problem like this too, because over there's not a problem like this for anyone, I guess. So it was totally accepting. It was like mind calming for me that someone is understanding the problem, right? So
Then when you met the gynecologist, I met first, then I referred you to the gynecologist.
right.
Yeah.
And she also tried to do a PV for me, even though she knew that we didn't have a sex. So, but I allowed her to do a little bit, and she was telling me that, oh yeah, that's really good. Some people even don't allow us to do it, so it's easier for you to get through it. So I was really like happy that we can achieve something.
You got the confidence after
Yes.
meeting the gynecologist.
Right.
Yeah. Then when did we start the treatment?
So as soon as we came in, the next day itself, we didn't have too much time. It was short period of time, so it was like we had to rush, and everyone over here had to rush too. So the next day itself, I had my hymenectomy done, the surgery done, and the next day after that, we started with the
Monday.
counseling.
We started on Monday.
We started on Monday.
Last Monday.
Yes.
Yeah.
On Monday, we started the sex therapy, and in 7 days, we were successful, which we couldn't do in
That is wonderful.
7 years.
You are the first couple recovering in 7 days time.
Right.
This is a record time in my professional career.
Yes.
There were couples who recovered even in 8 days, 10 days. But usually average time, I tell the couple is 14 days.
Right.
It may varies from 10 days, 14 days. For some people, maybe 2-3 days more. It all depends on the cooperation and the mental state of the persons.
Right.
So what was the experience in sex therapy? How was it? How did you feel? Did you have any difficulties, any stress, any trauma?
Actually, it was kind of a honeymoon period for us, because even in our honeymoon, we were so much stressful, not like the other couples. So when we came here, it was so mind calming for us. The exercises, the therapy, the relation between both of us went so deep and good. We felt so good. It was not at all difficult for us.
Now, what was the difference in your intimacy and relationship before you coming here and after you came here? Was there any difference in this aspect?
Yes, there was a lot of difference, because I don't know, because of my stress and his stress, we used to fight for small things. But then when we came here, we didn't have any stress, no work stress, no home stress, no bills, nothing. So we were like stress, totally out of stress, and we went into this therapy, and we got too much closer to each other, I think. At least after 7 years, I'm so
It's a
glad.
sort of exploring and finding out what he is,
Yes.
what I am. That is what we say in focus in sex therapy.
Yes.
We help the couple to find out who am I and what is my sex life, what is my sex. First, I should be comfortable with my own sex. Then only I can relate with somebody.
Right.
So based on this concept, we try to help people. So in that process, you understand about your body and yourself along with the understanding of your partner. You also understand your partner well. Probably that is a time when, from my experience, many couples see each other without clothes
Yes.
and in a lighted room. Many couples come and tell me that we all do it in the darkness. Even my wife doesn't permit me to switch on the lights, and she doesn't do it in daytime. These sort of experiences are there. So our aim in sex therapy is to make both of you comfortable, make comfortable first, comfortable with each other, then to focus on building up the relationship. As a main part, the communication between the couple that we focus, then that intimacy will develop. Gradually, through this process, we plan to desensitize the fear or anxiety, what you were describing a few minutes ago, that we desensitize, and as a result, you are able to engage in a normal sexual contact without any fear or apprehension. Yeah, anything else would you like to share for the future generation or the viewers of YouTube channel?
So I would say to the other people, just like us, don't keep your mouth shut. Just talk to your elders, just talk to whoever knows about this, get a treatment done, and it is like magical. It will really work as a magic, and it will increase the intimacy of the couples and the confidence between each other, the relationship. It's like really magical. I don't have any other words about it.
Yeah.
And also, I'll add, when I first came here, I had no confidence that this was going to work because I had a lot of failed, in the past. So as soon as like 7 days left and all the exercises and like the feelings was getting deeper and stuff like that, and we could really do it. So that's when I really said, we should have done it, many years ago. We couldn't, we finally found the right spot and the right institute, and we made it happen. It happened in 7 years that we were married. It happened in 7 days. So that was one of the biggest things that I could remember.
Yeah, here clinically, if we analyze their problem, it is a case of vaginismus. Vaginismus is contraction of outer 1/3 portion of the vagina, causing an occlusion so that penetration of any object into the vagina becomes impossible. That is a typical sign of vaginismus. When the partner tries to penetrate into the vagina just becomes like a balloon. Close the vaginal orifice and inside it will be just like a balloon. So penetration of any object, not even penis or a finger, doesn't occur. And usually these women, they push the husband away with both hands or with the thighs, or keep their body closed. Some people may turn to the other side, they may move back on the bed. These are the typical signs of vaginismus. And due to the vaginismus, it leads to an unconsummated marriage. Even after many years of marriage, the couple is not able to engage in a normal, proper sexual contact. Why the people in London or the doctors in London were not able to understand this situation? because it is a cultural difference. There, most of the people, they start their sexual life during their teenage itself, and these sort of stories are not there. So here, this gentlewoman, what happened to her during her study days, student days, some of her, one of her classmate or friend got married, and she had a very bitter traumatic experience in her bedroom that she shared with her. That is what went into the back of her mind, and when she reached the bedroom, the same fear flared up, and that was the cause of developing her vaginismus. And with 7 days treatment, it is cured. I am really happy and thankful to both of them. They have cooperated so well. That is why we could finish it in 7 days. This is the first case I could finish it in 7 days throughout my professional career. So especially I am grateful to both of them, and thank you very much for sharing this experience for the YouTube viewers. Thank you very much. Once again, we will meet with another video. Thank you.